교통사고의 가장 중요한 치료는 통증 치료입니다. 그래서 오늘 통증 전문 의사 Dr. Chang 모셨습니다.
안녕하세요, Dr. Chang입니다.
Dr. Eric Chang and I have worked together for years. I've worked with hundreds of pain management physicians in Los Angeles and Orange County, and I will say with pride that he's one of the better ones, I'll tell you that. Today though, we're going to talk about things dealing with car accidents and the treatment that a lot of people typically just come to me and ask me questions about when it deals with pain management care. One of the most common types of treatment that clients have is with regards to epidural steroid injections, along with other types of injections as well, like facet block injections and things like that. But can we kind of talk about that? What exactly is an epidural steroid injection?
And so an epidural, the main purpose is to help with nerve pain. So if you have back pain going down your legs caused by sciatica, it's usually an irritation caused by the body, and there's these irritating substances that get on your nerve. So one of the main purposes is to try and clean it up. So we do inject volume and fluid to clean off the nerve from those irritating substances. The second is an anti-inflammatory to keep the swelling down. Another way I like to look at it is if you're having pain, you can either make the house bigger or make the people living in the house smaller. And if the nerve is swollen, one of the ways to decrease the size and inflammation is to do an epidural.
So what's actually being inserted into the body is what clients ask me a lot of times.
Sure, so we do use a needle. The tip is the size of a ballpoint pen. But before we do anything, we make sure the patient's comfortable. And there's two types of anesthesia we use. We use a local anesthesia to numb up the skin. And we also, through an IV, make the patient feel very comfortable. And some choose to be completely asleep comfortably. We monitor the vitals, to make sure nothing bad happens. And as long as they're breathing and doing well, it's a clear sailing procedure.
So between when you have, the concept of going under and then, being awake while that is done,
Sure.
Can you talk to me about both of those things? Is that a norm? What exactly happens?
So it depends on the goal of the patient. Sometimes the patient, their priority is to not be sedated and just be awake. So we allow them to choose. It is the patient's choice. We never choose for them, but if they're concerned and because of the fear of the procedure, I generally suggest anesthesia.
If we could talk about the quick beneficial effects of the steroid injection. So as soon as somebody gets an injection done, what typically is the result right away?
Sure, they might feel that their pain has diminished because of the washing effect. So the irritating substances are washed off at that particular moment. They continue to have improvement over the week. The steroid takes about 5 to 7 days to decrease the inflammation and the size of the nerve.
I see. Okay. People fear the unknown, right?
Sure.
They fear what they don't know, and for a lot of my clients or just people in general, when they hear the word epidural, they think pregnancy, right?
So,
I'm not pregnant. I don't need the epidural, but that's certainly not the case.
No, epidural in that term is just describing the space that we go into. And for an epidural during pregnancy, it's a different type of procedure entirely. So it's apples to oranges. It's not the same.
Got it. They always ask me, what are the side effects?
Sure. Well, if you're allergic to any of the materials that we use in epidural, then we actually will catch that beforehand. It's very rare people are allergic to lidocaine or bupivacaine, and your doctor, before you come, would have told you that. So it's entirely safe before we even go to the room.
It's either when they have the pain, the epidurals, or the facet.
Sure.
Can you talk about some of these facet injections?
Sure. So diagnosis is important. We'll make the right diagnosis, and then we'll make the decision whether you'll need an epidural or a facet block. For an epidural, it's generally nerve pain. For facet blocks, it's generally whiplash or bony arthritis type of pain.
I see. There's one other thing that people who've been involved in accidents, when they go see a pain management physician, they would sometimes recommend something called a RFA, a radio frequency ablation.
Sure.
Sounds very cool,
Right.
but what exactly is that?
So it's using energy to remove the pain fibers. So when acute pain becomes chronic pain, it's because these pain fibers grow into the bones of patients such as people with car accidents that suffer whiplash. Most people will get better in 3 months, and that will be acute pain. But if the pain lingers, it's this chronic pain. And the underlying reason is that these pain fibers grow into the joints. And a non-surgical safe way is to use high energy and put this energy over the bones. It takes about 90 seconds to do, and it's a really safe way to treat this type of pain.
Rhizotomy.
Right.
What is a rhizotomy?
So once again, a rhizotomy is after we do facet injections and then we get good results and it shows that it's the appropriate levels. We'll use the rhizotomy, which is high energy, and place that energy at the level of those bones and kind of yank the weeds out from the graft and make sure that your anatomy stays perfect and only the pain fibers go away.
A lot of even my clients, I've represented thousands of clients, there's a lot of myth out there with regards to pain management, and they are just very afraid of it. But what are some of the myths that you've heard that you could just bust, or just
Sure.
so people could really understand that pain management is a safe thing?
Well, the good news, it's very difficult to paralyze someone because the spinal cord ends much higher than where we do the injection. So it is 0% chance to go in the lumbar spine to paralyze someone.
Thank you for your time today. I really appreciate it.
Thanks.
Thanks. Okay.